All right, so you've been dealing with this persistent hip pain or back pain that's worse with sitting, and you feel like it just kind of undoes all of the things that you're doing to help. So you go, maybe you get worked on, or maybe you're doing some things on your own, certain stretches, different treatments. And then when you go and sit for too long, that feels like it undoes everything that you just did. And now you feel tightness, feel discomfort, feel pain again. It's harder to do the activities that you want to do. So what's happening is the things that are making you feel better are causing your nervous system or your body to kind of ease out of that more guarded state. When your body is in a less guarded state, then your muscles are activating better. They're not as tight. So you're moving better, you're feeling more in alignment, you're feeling less out of balance, and pain will be harder to trigger. But if your body is in a more guarded state, then muscles start to tense up, they feel tighter, they're not activating as well, they feel weaker, you feel out of alignment, you feel these muscle imbalances, and pain is either present or easier to trigger. And your body can enter this guarded state from a movement it doesn't like, from too many movements it doesn't like, from positions that it doesn't like to be in, and really any movement or any position is just stress on different areas. And every position is slightly different. So this position I'm in right now is putting different stress on my joints and muscles, tendons, ligaments, as is this position, as is this position, as is this position. It's all different, and your body is interpreting all that information and deciding whether it feels that this is an okay thing to do or whether it's putting too much stress on an area that it's not comfortable with. And so what you need to do is figure out, well, if my body doesn't like sitting, how can I change sitting in order to make it more tolerable and not set off any alarms that put your body into a more guarded state, undoing the treatments that you just did? So let's talk about a few of the more common ways and then some of the more uncommon ways that you probably haven't heard of. And so the first you may have been recommended is to sit upright. So sit with as good posture as you can. And this can help for some people, especially if your lower back is sensitive to being flexed. Sitting in a more upright position can make you feel better. So if you haven't tried that, of course, this is the first thing to do. And you can add some sort of lumbar support roll. I just made this by rolling up a towel. You can wedge this into your lower back, the small of your lower back, and this can prop you up and support you in sitting this way. So this may be helpful for you if your spine is sensitive to being flexed. But what about if it's not? What about if that doesn't help you? What else can you do? And so maybe for you, despite everyone telling you you should sit in good posture, maybe you need to round a little bit more to take some of the stress off of your lower back. Maybe this is being interpreted too negatively by your body and you need more of this, at least for the time being. And really, no matter what position feels better or worse, you don't want to stay in any position for too long, so you still want to vary your positioning. But what about if that doesn't really help you either? Well, what else can you do? And so there are a lot of other ways that you can sit. You just have to start thinking outside of the box a little bit and experimenting on what your body is telling you about each position. So you can sit like this. You can sit with one foot forward. You can sit with the other foot forward. You can sit with both feet back. You can sit with one leg propped up onto something like this as you're working. You can sit with that leg extended as you're working. You can have both propped up as you're working. You can have both extended as you work. You can turn your body a little bit towards the side and have a little bit of spine rotation to some varying degree, and you can test that. You can test the other side. You can test leaning a little bit more one way than the other. And it's not like you're doing these positions for a long period of time, but you want to find positions of comfort that you can alternate between. Play with these variables so you can experiment with motion, experiment with position, and see how your body responds to each one so that you have a couple different go-tos when you're sitting. And once you can find one or a few that allow you to sit longer without triggering anything, then you can keep that window open where you're moving better and feeling better after your treatments so that you can start to make steps towards recovery because you no longer have this variable that's working against you closing that window. And so if this was helpful, let me know which position felt the best for you. There are way more than what I just showed you. It's really about just getting creative, starting to think outside the box, and then listening to your body. And that can take time.